right, so I'm going to do an arterial blood gas. So before I ever take a blood draw for anybody, I always need to check the chart to make sure the physician ordered it for that patient. So I'm going to check the charts, and also when I'm checking the charts, I need to see what medications they are on, if they are on an anticoagulant, anything that could cause the bleeding to go longer. So when I am ready, I always knock on the door, introduce myself, and I always check the ID band of the patient. And when I'm ready, and I'll wash my hands, dry them, and then apply the appropriate gloving. And then before I always get a blood draw, I always want to make sure I get the vital signs before, and also especially the temperature, because that will be needing to be placed on the label. So when I do an arterial blood gas, I always want to inform the patient on what I will be doing. So today I'm doing an arterial blood gas. So with that, I'm going to be taking it from your wrist out of your artery and not from your vein. So it's going to be a little sharp pinch. It's not going to be as comfortable as what the other one is. So that way you know. And so when I go to do an arterial blood gas, I'm going to have them do a fist 3 times, and then on the 3rd time I need to see what their skin flushes back to make sure it comes back in within the certain amount of time. So when doing a modified Zalens test, I always want to include the radial and ulnar artery. So when I have them do the fist 3 times, and after the 3rd time I want to release the ulnar artery, and I want to see how their blood flow goes back. If it goes back in a good time, then that's a good arm to do it on if the blood flow is good. But if the blood flow is not good, I need to check the other arm. I always want to try to get the blood draw from the non-dominant arm. So saying this is the non-dominant arm, so I'm going to palpate the radial artery to make sure I find the pulse. And then I'm going to take the alcohol prep wipe. I'm going to clean it off in a circular motion, get everything cleaned off. And I always, before I stick a needle in, I always want to make sure that's dry. And when I'm ready, then I can get my needle ready so I can remove the cap. And when I have it, I always want to make sure before I remove the cap, make sure it is placed at the appropriate milliliters that the lab will need for the blood draw. So when I hold this, I always want to have the bevel up, and I want to hold it at a 45-degree angle like I would be holding a pencil. So when I'm ready, I always palpate the pulse, and then I would stick it in, and with this, it should go straight into the tubing. Now, when you're doing an arterial blood gas, you can have like a towel or something, so that way it extends their hand out for you to make it easier. And when you're done, you carefully remove the needle, not to poke yourself, and hold down. And sometimes you may have to go longer than 10 minutes, just depending on what kind of medication they are on. So always with the needle, you want to put it into the stopper, so you'd push it down to make sure it curls the needle. Then you can remove the needle and place it into this and the needle into a sharps container. So once you have the needle removed and disposed into a sharps container, then you would remove any air bubbles that you may have and place on a protector here, so that way you don't lose any of the sample. Then you can always move it to make sure everything is good. Then you would place it into your biohazard bag here. Now for the patient, you always want to place a Band-Aid onto the patient's wound site there, and you want to advise them to leave it on for 4 hours at least, just so that way there's no infection, and that way the wound site does not reopen and cause that infection. So always, when you have done a blood draw or anything like that, you want to have a label to go with your blood sample. So you want to have the patient's name, their temperature, their room number, the date that I did the procedure, what test I did, so I'd put in ABG, and then the time that I did the ABG. And then if the ventilation would be if they're on oxygen. So if the patient is not on oxygen, it's at 21%, so you put 21%. Then you would place it onto the biohazard bag. Now, if you can't get your blood sample to the lab right away, have some ice with you and place it on ice, and so that way it doesn't create any clotting. So once I am done, I need to dispose of anything that the patient, any blood, anything that may have touched, and I would also remove my PPE here, wash my hands, dry them, and then I would reassess a patient after any procedure. I always need to get the post-vital signs to see where they are at and check on the patient to make sure they don't need anything from me. Once I am done, I can make sure that lab sample had gone to the lab and chart anything on the charts that I have done for the patient.